Hey everyone, Michelle Seidling here with another episode of Food Experience Unplugged. Today we're looking at the importance of food and wellness on addiction recovery. Here to help us do that is Joshua Todd, a habit coach specializing in mental health and addictions. Josh Todd, welcome to Food Experience Unplugged.
Hi, thanks for having me.
Hey, thanks. Well, it's sure a pleasure to have you, Josh, here as we discuss the relationship between food and wellness and addiction recovery. And you've got a rich background with working with addiction recovery and mental health situations. Let's just start out with, will you just introduce yourself and what brought you to this point?
Yeah, sure. Right. So my name's Josh. I currently live in Kitchener, Ontario, Canada. I grew up in Timmins, Ontario, which is about 10 hours north from here. So it's pretty far north. It gets cold up there. So after high school, I went to the University of Guelph, which is another town about 30 minutes from here. So I double majored in psychology and criminal justice. And then after that, I kind of took a break and just trying to decide what to do afterwards. And after that, I took another program called concurrent disorders. So for anybody who's not aware, a concurrent disorder is when somebody has both a mental illness and an addiction at the same time,
Okay.
which they usually coincide. Usually, they say between 20 and 80% of individuals who have an addiction have a mental illness. So that's a huge gap, right? So it's safe to assume that somebody with an addiction has a mental illness. So that's why they go hand in hand a lot of times. And then, so my first job in the field was at a residential facility for people who are just coming out of prison.
Okay.
So it was a treatment center for addictions and mental illness. And then, so I worked there for about a year and a half. And then I've also worked at a private rehab facility. I've worked as a community mental health worker, so going out into the community where people are living. So I would literally go to their homes and work with them in their environment, and that's pretty much what I'm doing now as well. I support individuals who are of low income and who are suffering from a concurrent disorder. And I've also just recently, about 7 months ago, started doing habit coaching on the side.
Okay, excellent. So you mainly focus on community health, community mental health, that
Yeah, and
aspect of
addiction.
it.
Yeah,
Okay. Okay. Wow. That's super important, especially in light of, just so much going on in the world and just different responsibilities and so forth.
yeah, absolutely. Like especially now, there's at least in Canada, it's probably the same in the U.S. I would imagine. But since the pandemic hit, there's been a very large number of overdoses. It's been going on for quite a while, but the pandemic has had a pretty huge effect on that as well. So we're seeing a lot of overdoses and people who suffer from mental illness. Their symptoms kind of being exacerbated by the stress of everything going on right now.
Interesting. So
Yeah,
yes, just to see how that, I mean, stress affects everyone differently, but just how that affects, that type of situation or exacerbates it, I suppose.
yeah. There's definitely a lot happening behind the scenes that a lot of people might not be too familiar with, right? The individuals I work with, a lot of them are very vulnerable, and they're low income, and um, they're in situations where a lot of people don't necessarily interact with them, so they
Mhm.
might not be aware of what's going on in those lives. Um, but yeah, it's interesting. It's a challenge.
Yeah, definitely. So, wow. What's the best part of your work? What really drives you and motivates you in your work?
A big part of the reason I went into this field is because I'm fascinated by human behavior. Um,
Mhm.
I love that aspect of it, of learning about people, and I also have a huge interest in how the legal system interacts with everyday lives, right? And unfortunately, a lot of times, individuals who have an addiction or mental illness at the same time, they run into the law, right? So a lot of times, those two things interact, and yeah. So I think the biggest satisfaction I get, I guess, is from just helping people, because a lot of times these folks don't have anybody else, and so it's nice to know that I'm having an impact on them, or at least I think I'm having an impact on them. It's not always verbalized by people. It's not. I wouldn't say it's a thankless job, but you definitely don't always see the progress that you're making. Right, a lot of times you're working with folks for um, a, a very long time, so sometimes it's difficult to see a progression or a improvement in people's lives.
Mm,
So it's that's a challenging part of it. But yeah, I just enjoy being able to help people.
okay. And do you typically work with other medical professionals as well? Like social workers or other different aspects of the situation?
A team I was with previous to what I'm working on with right now is called an ACT team. So ACT stands for Assertive Community Treatment. So what that means is there's multiple different professions on the team who help folks that we support. So we have uh, nurses, occupational therapists, rec therapists, social workers, and we also interact a lot with psychiatrists. Um, so right now, the team I'm working on with, they don't necessarily have access to those services. So I try to navigate the system and help my folks interact with the medical profession as well. So yeah, I interact a lot with doctors and nurses and social workers.
Okay, that's wonderful. So
Yeah.
you're kind of are you kind of the first line of defense, so to speak, the first one that they come in contact with?
Yeah, the folks that are on my team. So um, we have a lot of people on our caseload, and they're kind of divided between a certain number of staff on my team, and we're all responsible for a certain number of clientele. So yeah, like the folks on my client list, I'm typically the first point of contact.
Okay, that's awesome that you can kind of be able to relate and address whatever services that they need or whatever coaching they need. That's fantastic. I love that. So now you also classify yourself as a habit coach. So now can you talk to us about what is the difference between a habit and an addiction?
Yeah, that's interesting, right? Because a lot of people, we kind of have this one definition for addiction and a definition for a habit. I think most people see addiction at, well, at least in the medical community, addiction is defined as a disease,
Okay.
and it's often treated as a disease. But I really disagree with that. I don't think it's a disease. I think at its core, it's very much a set of habits that people have developed over time. I think people's reliance on the definition of addiction as a disease is because it has physiological consequences to the person, right?
Okay.
Um, because it affects our brains, it affects our bodies. So it very much, I guess, presents as a disease. But at, at its core, I think it at its core, I think that those physical issues are symptoms of the addiction itself, not directly related to it. Do you know what I mean?
I think so. Is there more? So a habit is what, and then an addiction
Right.
is what?
Right. So, okay. So an addiction. So a habit I would define as a set of behaviors or a behavior that people have developed over time that is continuous, right? So it's repeated over a certain period of time, um, almost to the point of it being unconscious. So the what I mean by that is the the feelings of desire that to do that behavior is
Okay.
unconscious, right? So it can pop into your head without even noticing what drives that person to do that behavior, right? And I
Okay.
think that applies to addiction as well. So if we take the habit um, of exercise, a lot of the behaviors that come with the habit of exercising mimic the same uh, behaviors as an addiction.
Hmm. Interesting. So, okay, if I go to the gym regularly,
Yeah,
and so do I have a habit or do I have an addiction? At what point would it become an addiction?
Yeah, that's a good question. So the way I would differentiate between, I guess, a habit and addiction is its negative consequences on somebody. So
Mm.
if, let's say, you go to the gym an hour a day, 5 days a week, I would classify that as a healthy habit. But if it gets to the point where you're obsessing over fitness and nutrition and looking a certain way that it takes over your entire life, like if it's affecting your relationships, if it's affecting your job, um, your health, even, right? Because exercising too much can have uh, a detrimental effect on your body. I think then we would classify it as an addiction
Mm.
once it starts to develop into the negative consequences.
Okay, so it's just the negative aspect of it and how it affects your life that makes it such.
I would say so, yeah.
Okay, interesting. So so you mentioned, with addictions, it's consuming your life. So how does that affect somebody's in terms of goal setting or in terms of, your normal course of life?
How does addiction do that?
Yes.
Yeah, it's like I said. So when people are experiencing an addiction, it's all consuming. That's all they can think of. Their entire life is built around that behavior or substance. Um, so when it comes to spending money, the only thing that they can rationally spend money on is that behavior or that substance. Uh, a lot of things that other normal, I say normal loosely, but folks who don't suffer from an addiction um, might prioritize in their day to day.
Hmm.
That just falls to the wayside with individuals who are suffering from an addiction. So whether that's their health or finances, relationships, um, all of that just it becomes less important than the addiction itself.
Okay. So the addiction becomes the priority in their
Absolutely,
lives,
yeah.
essentially. Okay.
I remember
Wow.
hearing a story. A client of mine shared a story where she was in prison at the time, and she was going for her sentencing, and all she can think of was the line of fentanyl that was waiting for her at her jail cell. To the point where her lawyer would be able to reduce her sentencing by a year and a half, but she
Mhm.
just all she wanted was to get out of there so that she can go back to her jail cell to consume those drugs. And unfortunately, it cost her another year and a half in prison. And so it just showed me like how much that addiction took over her mind, right? So
Mm.
a year and a half of her freedom was lost because of that one line of drugs that she was waiting for at the in her jail cell. So I think that's a good demonstration of how much an addiction can be all consuming, right? It just everything else is not as important as the drug or the behavior.
Now, is it mainly with addictions? Do you mainly focus on drugs and alcohol, or are there other addictions that you address?
In my role as an addiction counselor, it's drugs or alcohol. But as a habit coach, I can basically work with any habit that an individual wants to get rid of or work on, right? So that could be alcohol or drugs or cigarettes. It could be internet use or cell phone use. Um, I've worked on I've worked with individuals who have uh, a habit of going onto um, porn sites or chat sites, things like that. So basically, any behavioral addiction or habit, I can help folks work on.
Okay.
Yeah,
Okay, excellent. So now moving into the food and wellness aspect of it, how does food and wellness contribute to addiction recovery or to mental health? Can you talk about that a little bit?
a lot of times things aren't prioritized as much as they should be. One of those being their physical wellness, right? And
Mhm.
that involves food and exercise and things of that nature. So one thing I one of the things I definitely notice the most in folks who are suffering from an addiction is that their nutrition just uh, gets completely disregarded, right? Whether that's because they're spending all their money on their addiction and they don't have enough money to spend on food, or they're just not hungry because that is potentially a side effect of whatever addiction they're suffering from. Um, I think nutrition and food in general can be a very good method of helping somebody recover, right? Because you're learning a lot of different things when it comes to nutrition that people might have lost along the way if they're suffering from an addiction. So, um, one of the symptoms of having an addiction is not being able to delayed gratification, right? They need things right away. And one of the things that comes along with cooking a meal is practicing patience. And, it takes time to prepare a meal and go shop for the ingredients and things like that. So I think um, building in those life skills of cooking and preparing a meal can really help somebody in recovery to learn those life skills that would help them along the way within their recovery.
Interesting. So, do you have, are there any examples of people as you've worked with them who have implemented that into their recovery process?
Yeah, absolutely. A lot of folks, once they're in recovery, they tend to focus a lot on their food. So I definitely noticed that once they've kicked their habit or addiction, one of the side effects is replacing their substance or behavior with food. So that's a lot of times that involves eating too much and eating too much unhealthy stuff, unhealthy food. And so one of the things I try to implement, myself and um, my colleagues try to help teach them is proper reading of labels, how to find affordable food that is nutritious, how to build a schedule around preparing food, all that type of stuff. So food actually has food and nutrition actually has a huge part in people's recovery because either they never learned the skills involved
Mm.
in shopping for food or preparing food, or they don't have the skills to make it right. Um, so food and nutrition actually have a huge impact on somebody's recovery because they're having to most cases they're having to learn a whole new skill that they never learned before.
Excellent. That's fantastic that they're really just turning their focus to something positive instead of
Yeah,
focused on their addiction.
yeah, it's really cool to see actually because a lot of times people's the folks I work with, a lot of times their biggest interest is food. Um, like I said before, a lot of times once they cut their habit or addiction, they tend to gravitate towards too much food. Whether that's because they have cravings and they need to substitute it for something, like people who quit smoking, a lot of times uh, gain a lot of weight after quitting smoking. Well, that's because a lot of times they're eating food to substitute those cravings. But yeah, I've definitely seen a lot of people who um, once they've are in recovery, they go to food and it's become a hobby of theirs and a passion of theirs. I'm thinking of one person in particular that I helped. She was homeless for about 20 years and she suffered from addiction. We finally got her housed into an apartment and she eventually kicked her habit. Um, and she just gravitated towards food every day. She would try a new recipe. She would look online for recipes. She was thinking about taking cooking classes. Like the food and nutrition just totally consumed her afterwards. Like it became a healthy coping strategy for her. I think it can be very useful for people who suffer from mental illness as well. Um, because if somebody's suffering from depression or anxiety, one of the best things that you can do is practice forms of mindfulness, right? Because a lot of our distressing thoughts come from thinking about the past and the future. And one of the qualities of cooking is being mindful of the present, right? You're there in the kitchen, you're focusing on chopping and cutting and sauteing or baking. Your mind is literally focused on what's happening in the moment. So I think that cooking can be very therapeutic for people who suffer from mental illness or addiction. Um, because the qualities of cooking and nutrition in general, I think, can have a positive impact on somebody's mental wellness.
What skills, as they're learning about cooking, mealtime, what
Yeah.
skills are they developing, do you think that is helping them in the recovery process?
Okay. Preparing those meals and reading labels and cooking nutritious food, that's teaching them a lot of things like patience, um, new hobbies, like learning that you can have an enjoyable time doing something that doesn't involve substances or addictive behavior, I think is very important, because a lot of people, when there's the thought of quitting a substance or behavior, is often very frightening for people, because they can't imagine uh, finding pleasure in things that doesn't involve their addiction, right?
Mhm.
So showing people that, cooking can be fun and enjoyable. You don't need to have, a glass of wine, or be high while you're doing it. You can simply enjoy that process. I think is very important, right? Um, so yeah, patience. It's showing them new skills, um, practicing, like I pointed out before, that the idea of mindfulness and being present in the moment. I think that's a very important thing, and very big part of how nutrition and cooking can be beneficial to people.
Absolutely. So yes, mindfulness is helpful regardless of your situation, but especially in these types of situations, people can sounds like people really latch onto it, and that's fantastic.
Yeah, and I think the word mindfulness kind of frightens some people. I know I've definitely uh, encouraged some of my folks to practice mindfulness and try mindfulness out, and I think a lot of people have this image of, you know this old white dude cross-legged on a carpet, chanting over and over again. But that's not necessarily what mindfulness is, right? Mindfulness is about being present in the moment, being aware of your surroundings, and kind of learning to let go of those thoughts that might be troubling you. um, and so I think cooking is a perfect example of how you can practice mindfulness without it having to be meditative, right? um,
Mhm.
or having those negative connotations that some people might have of mindfulness. It doesn't have to be, sitting in a dark room and just being in a quiet place. It could be, you can implement mindfulness in everything that you're doing. Um,
Mm.
and I think
Okay.
cooking offers a very good opportunity to practice that.
Sure, absolutely. Now, do with regard to the cooking and introducing them to those things, is that do you personally work with them doing that?
Yeah, I can. I also have, yeah, on the team I'm working on right now, we have a role. It's called the life skills worker, and the
Mhm.
life skills worker generally work on things like that, right? So whether that's learning to properly care for your apartment, or um, you know going grocery shopping, or cooking. So they would normally be the ones that are helping people do that. But I have worked with folks where I've gone to the grocery store with them, taught them how to read labels and purchase food that are affordable but nutritious as well, and then going through the process of learning how the kitchen works, right? A
Mhm.
lot of It's shocking how many people don't know how to use a stove, right? So just the very basics, I sometimes have to teach people how to work around their kitchen.
Mhm.
um, so yeah, it's definitely a challenge, but it's a huge part of uh, implementing a well-rounded recovery process for people.
Sure, absolutely. And just turning their attention to those basic skills. I love how they're refocusing, redirecting their efforts. And now, how do you feel that as they're gaining these skills, as they're gaining, does that help them in other aspects of their recovery? 'Cause I would imagine recovery is probably a multi-pronged, process.
Oh yeah, yeah. When we're addictions and unhealthy habits can, like I said, be all consuming and affect a, a person's entire life, right? So yeah, cooking and nutrition can definitely transcend into other areas of life. So whether that's financial, relationships, um, health in general, right? If they're learning how to cook and shop properly, they're learning how to care for themselves, and I think that's one of the biggest things that nutrition and cooking can offer somebody who suffers from an addiction, or mental illness, is learning that you can take care of yourself, because a lot of these individuals, unfortunately, they feel like they're defined by their addiction or unhealthy habit, and so uh, teaching them that you can take care of yourself and have pride in what you're doing. I think that just transcends into all facets of life. If you're taking care of yourself and finding pride in what you're doing, then I think it'll come out in all areas of life.
Yeah, interesting. I love that because they're more, is it that they're more apt to learn additional skills, whether it be with food and wellness or with other topics?
I think so. I definitely noticed that folks who are in recovery want to learn as much as possible, right? And nutrition is definitely one part of it, but also learning how to take care of their apartment um, or their finances or relationships. A lot of times, unfortunately, when we have an addiction or a really bad habit, it usually affects our social life as well, right? So, food can definitely bring people together, and so,
Sure.
uh, learning how to cook for a loved one or something like that can definitely help reignite those relationships. Um, food, food and nutrition just it affects everything, I think, and can help people improve other areas of their lives, not just their physical well-being.
Mm, absolutely, because that's um, so you because you mentioned the connection between addiction and mental health. So I would imagine as they overcome their addiction, their mental health improves as well as their physical or other aspects of their health.
Yeah. Um, um, with mental illness, a very common theme I see is lack of motivation to do things. Not not at their fault at all. It's definitely the mental illness itself. A
Mm,
symptom of most mental illness is lack of motivation and inability to care for oneself in severe cases, right? And so I think that once people find the motivation or have that motivation to do something else or to learn a new skill, it definitely helps them in their recovery, right? I think way too many people rely on medication these days. I think we overprescribe individuals with medication. Um, I think that we need to focus more on outside sources of happiness and joy. I think that we need to encourage people to socialize more, exercise more, eat properly before we jump to prescribing a medication. So I think that if people can uh, kind of cling to the idea that I can take care of myself and and be happy in the kitchen, that'll transcend into other places, right? I might be willing to try exercise or find a new hobby or go out and socialize more. And I think those things are more natural ways of finding happiness and contributing to somebody's overall mental wellness versus just medication alone, right?
mm.
So I think it's important.
Absolutely. So, do you find that some clients that you work with, uh, do they not need medication? That those other aspects of the recovery and the health help them. That they don't need medication as one of those approaches.
I wouldn't say that. Um, a lot of the folks I work with have very severe mental illness. So I'm talking about people who live with schizophrenia or live with bipolar disorder, very severe mood disorders like that. Um, they absolutely do need medication to help with their symptoms. But I'm talking more of things like people who are diagnosed with um, anxiety and depression, things like that are very much brought on by our environment. I think can be very much mitigated by taking care of yourself and socializing and exercise, things like that. Um, those have a very big role in helping to relieve some of those symptoms. But when we're talking about very severe mental illness, like schizophrenia or bipolar disorder, then yeah, medication is absolutely necessary.
Okay. So,
And yeah, the way I see it is medication. It's not a panacea, right? It doesn't cure everything. I think the way I see medication when dealing with mental illness is that it provides you with a good foundation to give you some motivation and energy to in order to take care of yourself, right? So I don't think medication alone is a solution. I think uh, it's an ingredient in a long list of ways to take care of yourself.
okay. So, depending on the severity of the situation, in milder situations, you could you could not omit the medication and just have different aspects. But in those severe situations, you're most likely doing medication along with some other different recovery aspects.
I would say so. Actually, we're seeing a lot more in the States and in Canada. A lot more. Some doctors are actually prescribing um, exercise.
Hmm,
So it's
interesting.
interesting, right? So rather than pulling out a prescription pad and uh, and prescribing them with antidepressants or anti anxiolytics, they're prescribing socialization and exercise. So it's interesting that in the past we would focus very much on prescribing people medication, but not focus at all on what their social life is like. So um, I think that we're slowly seeing a shift in mentality as far as how to deal with people's depression and anxiety, um, by focusing more on social aspects and taking care of yourself rather than just giving a medication.
Interesting. That's great. I love that. So it's becoming more holistic,
Yeah,
essentially.
absolutely. Yeah.
Okay.
And it's good to see, right? Like I said before, if you need medication to help uh, with those feelings that you're having or experiencing, then absolutely take it. But I think I would encourage people to look elsewhere as well. So healthy eating, exercise, socializing, things like that, I think can have a huge impact in people's mental wellness.
Absolutely. So now, are there what steps typically, as people try to overcome their addictions, what steps do they go through to integrate maybe these recovery processes or different things, how they're getting from point A to point B, essentially?
Yeah, I think that's another scary part that people have when they have a negative habit or sorry, an unhealthy habit or addiction. They don't really know where to turn, right? And that's really scary because you're thinking about having this very significant transition in your life and you don't really know where to go. Um, but depending on the addiction or negative habit, there's many resources. You just Google anything really. Like uh, there's coaching apps online like Coach Me, where there's a variety of different coaches that can help you with whatever it is that you're struggling with. If you're struggling with substance use issues, then there's AA, like Alcoholics Anonymous. That's everywhere, right? In North America, there's Narcotics Anonymous. There's even apps that are helping people with their addictions, right?
Mm,
There are apps out there that help people cut back on alcohol or quit smoking. Um, so technology has definitely uh, been a big has has been developing ways to help people overcome those addictions or habits. Um, I would even also encourage people to ask their employer, like if they have benefits, medical benefits. A lot of times those cover therapy or psychotherapy, things like that. I would encourage them to look out for that. Um, yeah, there's tons of resources out there.
Sure, sure, absolutely, and that's fantastic and so vital to the process. Definitely. Even you specifically work with a certain demographic, but really addiction can occur pretty much anywhere to anyone. Is that what
Oh,
you're seeing?
yeah, yeah. I've worked with folks on both sides of the spectrum as far as um, wealth. I currently work with folks who are at the bottom end uh, of of the income spectrum, right? Like they're very low income. But at a private rehab I used to work at, I was working with 1% earners, right? I was working with folks who work on Street in Toronto, which is the equivalent of Wall Street in the States. Um, so I've worked with millionaires, I've worked with doctors, I've worked with lawyers, and I, addiction affects everybody. It doesn't matter what age you are, what sex you are, how much money you make. Everybody can be affected by it, and I've definitely seen it firsthand.
Yeah, yeah, and but the good news is that recovery is possible, and there's so many different resources as you mentioned. So that's fantastic to really redirect people toward a healthier life.
Yeah, absolutely.
So wonderful. Well, Josh, how can people get in contact with you?
Yeah, so I you can find me on LinkedIn. So my name is Josh Todd, and I'm the redhead. I'm probably the only redhead on LinkedIn, so you can click on that. If anybody's interested in coaching, personalized coaching for negative habits, I'm at Coach Me. So the URL is www.coach.me/jtodd100. I also have a website where I post blogs, and you can also find ways of hiring me if anybody's interested. It's www.healthy-habits.ca. I'm hoping you can put that in the description in case anybody missed it. But yeah, those
Yes.
are the ways to get me. Get in
Yes,
touch.
absolutely. We'll include all of that information in the show notes so people can look you up for more information. And it's really been a pleasure, Josh. I really appreciate all the work that you're doing with so many people to help them to turn their life around, move away from addictions, and really focus on their health.
Yeah, thanks for having me. It was fun. I don't normally talk about the food and nutrition aspect of recovery, but I think it's very important that we do talk about it because I definitely see the impact that it has on the people I work with.
Absolutely, and we are grateful for this conversation. So important. Thanks, Josh.
Yeah.
If you enjoyed today's episode, be sure to hit the like button and subscribe to be notified as new episodes become available. You can also visit our website at foodexperienceunplugged.com to check out some free resources on helping you develop healthy eating habits for life success.